In this video, we will introduce you to the TORQ Sternal closure device and explain the techniques needed to use it correctly. While viewing this video, you will learn how to properly use the TORQ and achieve consistently secure closures. The TORQ works with USP size 5, 6, and 7, or metric size 7.0, 8.0, or 9.0 steel wire sutures. Do not use the TORQ on patients with poor bone quality, where full wire tension should be avoided. Before we begin, let's look at the components of the TORQ: the head, the handle, the winding shaft, the body, the wire slot, and the foot. Now, let's get started. Step 1. Load the wire into the winding shaft. The scrub nurse should load the free end of the wire into the TORQ before handing it to the surgeon. To do this, hold the TORQ upside down and insert the wire end into either hole in the winding shaft. Hold the wire against the head of the TORQ with your thumb. It is important to keep your thumb on the wire to ensure it stays in the hole and becomes tightly twisted around the winding shaft. Rotate the handle one complete turn until you can see the remaining hole in the winding shaft. The wire is now locked in the TORQ and can be passed to the surgeon. Step 2. Apply the suture. Using your regular technique, drive the wire through or around the sternum. Now, clip the wire as close to the needle as possible. Step 3. Load the second wire end into the winding shaft. Hold the TORQ upside down and insert the second wire end into the remaining hole in the winding shaft. While holding the wire in place with your thumb, twist the handle one complete turn to lock in the wire. Lay the TORQ down on the side of the patient and continue loading the wires into the remaining TORQ devices. Step 4. Approximate the sternum. Lift the TORQ devices above the patient to bring the sternal halves together. As you pull up, you can even the lengths of wire by moving the TORQ devices back and forth. At this point, it is not necessary to fully approximate the sternum. Step 5. Load the wire into the wire slot. Hold the TORQ with the wire slot facing the sternum. Depending on what feels most comfortable, the handle can face either towards or away from you. Now check to ensure that the wire is not twisted. If the wire is twisted, it could get stuck inside the TORQ, making it difficult to add appropriate tension. Next, swing the foot of the TORQ around so the wire slot is facing up, and the device is tilted at a 45-degree angle relative to the sternum. The foot of the TORQ should now be pointing towards the xiphoid or the manubrium. Now place the wire into the wire slot, one strand at a time. Keeping the TORQ tilted at a 45-degree angle, pull upwards to add tension to the wire, which will pull the wire into the slot. The wire slot is made up of two components, an inner slot and an outer slot. When the head and body are correctly aligned, the inner and outer wire slots will be open all the way down the TORQ, and the wire will load easily into the wire slot. If the slots are not aligned, the wire will not fall completely into the wire slot, and the TORQ will not function properly. If you notice that the slots are not aligned, simply rotate the head and body until the wire slot opens. Step 6. Tighten the wire. With the TORQ at a 45-degree angle, use the handle to start tightening the wire, making sure the wire stays inside the slot. Continue winding the handle until the foot of the TORQ is tight against the sternum. Next, load and tension the wire of the remaining devices. After tightening all of the wires, you can go back and add more tension to the TORQ devices. This allows you to achieve a stable sternum without worrying about wire breakages. When using 7 or more TORQ devices, or if the patient has a short sternum, it may be difficult to bring all of the devices up on the sternum at once. In these cases, we recommend that you bring up 4 TORQ devices first, tighten and cut the wires, and then secure the additional wires using the remaining TORQ devices. As tension is applied, the wire slot must not face the side of the sternum. This can cause the wire to come out of the slot. If anything unusual happens and you need to remove the TORQ, use a cutting slot at the back of the device to cut the wire. Then, lift the TORQ up off the sternum. Step 7. Twist and cut the wire. Using the handle, first check to ensure that the wire is tight. One indication of this is the alignment of the spring and the handle. If the spring and the notch indicators are at 90 degrees to each other, there is no tension on the wire. As the wire is tightened, the spring and notch indicators move into alignment. Now, to create the wire twist, hold the body of the tool stationary and turn the head clockwise until you feel the wire cut automatically. Then, simply lift the torque up off the wire in the sternum. There should not be resistance when twisting the wire. If you feel a strong resistance, this could indicate that the wire is caught inside the device, and the torque will not function properly. In this case, cut the wire using the cutting slot and remove the torque from the sternum. The cutting slot should also be used if the torque runs out of threads during twisting and the wire is not cut automatically. Finally, bend the wire twists over using your regular technique. Now that you've seen how to use the torque properly, we strongly recommend that you practice the procedure and are comfortable with the torque before using it in surgery. You will soon see how easily the torque helps you create consistently secure sternal closures. If you have any questions about the torque, contact your sales rep or send an email to torq@cardium.com. The TORQ Sternal closure with a twist.